Limit patient movement and transport outside of the isolation room for medically necessary purposes. If any caregivers would like assistance in this process by infection control, please call. If transport or movement is necessary, follow the current recommendations based on the patient's situation. Notify personnel in the receiving department of the isolation status of the patient and the necessary precautions. Isolation signs should be posted in the receiving department or area. Do not remove the isolation sign from the patient room. If the patient is going to be transported in a wheelchair, before entering the patient's room, the transporter must perform hand hygiene. Don PPE to enter the patient room and prepare the patient for transport. Place a surgical or procedure mask on the patient. The patient should be instructed on how to properly wear the mask and to keep the mask on for the entirety of the transport. If a mask cannot be tolerated by the patient, apply the most practical measures, such as holding a Kleenex over the nose and mouth, or cover the patient's nose and mouth with a clean sheet to contain respiratory secretions. The patient should perform hand hygiene before leaving the room if possible. Place a clean sheet or blanket over the patient during transport. The transporter should doff PPE just before exiting the room. Wipe down the handles of the wheelchair, perform hand hygiene, and then transport the patient. No gloves, gowns, or eye protection should be worn when transferring the patient. Caregivers' hands are clean, touching the clean part of the wheelchair, and their hands need to be clean for transport processes, for pushing elevator buttons, opening doors, etc. If the patient is going to be transported in a bed or cart, ideally 3 to 4 caregivers should be designated for the transport process. The first caregiver should be in the patient room, donned in the proper PPE to help get the patient ready for transport by placing a surgical mask on the patient. The patient should be instructed how to properly wear the mask and to keep the mask on for the entirety of the transport. If a mask cannot be tolerated, apply the most practical measures, such as holding a Kleenex over the nose and mouth, or cover the patient's nose and mouth with a clean sheet to contain respiratory secretions. The caregiver in the room will help maneuver the cart or bed to the patient room door. Their caregiver in the room does not participate in the transport of the patient. They will doff PPE appropriately and perform hand hygiene once the patient has been handed off to the other caregivers. The designated caregivers that will be transporting the patient should be donned in clean PPE during the transport. These caregivers should perform hand hygiene and then don their clean PPE. These caregivers should not touch any public spaces, such as doors, elevator buttons, etc. There will also be a designated caregiver that will be the clean caregiver, donned in a respirator or surgical mask and eye protection. No other PPE should be worn by that caregiver. This caregiver will be designated to manage the doors, elevators, and public spaces. After the cart or bed is returned, caregivers will doff PPE appropriately and perform hand hygiene.